Joining us now is Dr. Michelle DeBlasi, a psychiatrist with Tufts Medical Center. Dr. DeBlasi, thanks for joining us.
Hey, Dr. DeBlasi, it's great to see you. School, as you know, is wrapping up in many communities, and even though it doesn't feel like it today because it's only like mid-60s right now, summer's just around the corner. So how can parents help their kids manage the transition from school to the long summer break?
I think my best advice for that would be to really set up a routine for your children when they're transitioning from school, which is very regimented and with a really strong routine, to the summertime. And so I think what I would recommend is to actually sit down with your child and kind of go through maybe what activities they might want to do this summer, whether that's organized activities like camps or just going outside to play, and sort of put together a calendar, a schedule that they might want to enjoy during the summertime. And having this sort of routine will give them this sense of stability that will reduce anxiety going into the summertime.
All right, let's talk about something else. While we have you here, over the winter there was talk of a national Adderall shortage. That's the stimulant medication to treat ADHD. Is that still a concern here in Massachusetts? And what, if anything, should parents of children with ADHD be doing differently to manage it over the summer?
So the stimulant shortage is nationwide, but it is seriously impacting Massachusetts, and it's still impacting Massachusetts. So my best advice to parents who have children who are struggling with ADHD and may need stimulant medication is to touch base with your child's provider, if you haven't done so recently, to see if maybe your child could need a lower dose or could take their medication less frequently over the summertime, where they may not be in activities that require sort of intense focus or attention span. And this will be, a relief to parents if they're able to do so that they're not constantly having to go to the pharmacy and be stressed over this serious shortage.
Dr. DeBlasi, let's switch gears just a little bit and ask you about some really interesting research that has just been released. It suggests that some of the sickest psychiatric patients may have autoimmune diseases. So, A, what's your take of this? And B, could we be looking at a revolution in how we treat some patients with serious mental illness?
So I think this research is absolutely fascinating. It's not necessarily completely new. We've always sort of known that there can be organic causes to psychiatric symptoms. But I think it really highlights and points out that we need to remember to keep organic causes in mind, especially with patients who are really seriously mentally ill or having very severe symptoms that simply aren't responding traditionally to psychiatric treatments. So I don't think this will necessarily revolutionize the way we sort of work with psychiatric patients with psychiatric illnesses, but I do think it is an important reminder to make sure that we're being thorough and especially thoughtful with these seriously ill individuals.
Dr. Michelle DeBlasi, thank you so much for joining us and talking with us about a whole different host of topics. We appreciate it, and stay well.
Thanks, doctor. Have a great day.
Thank you, doctor. To our viewers, if you have any mental health questions that you would like our experts to answer, it's easy. Just email them to ask@wcvb.com.